Wasn't Where'd he go? Wasn't he here earlier? What a meme, Bernard Sanders. Um, Mixed bag today. Unfortunately, we had good news yesterday with no members of the community passing away. Today we lost 6 members of the community. 4 of our neighbors in hospitals. 95-year-old male, 87-year-old male, a 68-year-old male, and a 61-year-old male. Certainly want to think about them and their families. Again, this process is very difficult. We all probably have known somebody now who's passed away from this virus, and today certainly someone who we knew passed away. So it's very, very sad. So let's keep them in our thoughts and prayers. We lost 2 members in nursing homes over the last 2 days, or last 24 hours as well. Related to the cases and where we're going overall, we're making some progress. 7-day rolling average is now 5.2%. When we look at hospitalizations, down 14 from yesterday, 181 in the hospital. We have 34 members of our community in the ICU. We have 5 members waiting transfer to the COVID transitional facility in partnership with Loretto. Overall, our hospital numbers, these are COVID-related hospitalization numbers. We track daily the total beds being used as well. And I think today was probably the best number I've seen since I've tracked it. So I think we had, normally we have about 1694 for hospital beds. The governor had the hospitals ramp up an additional 25%, so you add 25% onto that. So capacity for 2,000, 2,100, and I think today's number was about 1,150. So that usually it's been between 1,200, 1,250, even when we're really under pressure. And not that we're not under pressure now, but things have gotten a lot better. At one point, we had 337, I believe, related COVID hospitalizations just in our county, and today, 181. New cases. So today, Thursdays, Fridays, and Saturdays are always the kind of the barometer days. That's when most labs report in, and that's when we see our highest caseloads. So today, certainly related to that, 2 weeks ago, I think we had 470 cases on a Thursday. Last week, I think we had around 370. Today, we have 220. So if we can sustain that momentum, we'll probably have the best week we've had since probably Halloween surge. So let's knock on wood. We'll see what tomorrow and Saturday brings. But regardless, even if we have higher cases tomorrow and Saturday, this week will be less cases than last week. So we're making progress. Reminder about specific testing. If you are symptomatic, we want you to get a PCR test. Please register at ongov.net/Cayuga Medical. Monday through Friday, 9 to 2 at the FSHOD. Weekend symptomatic testing, Nescentia Health on West Genesee Street. Again, thank you, Nescentia. Again, same website, ongov.net/Cayuga Medical, 8 to 12 on weekends, Saturday and Sundays. Demand at these sites has gone down. And so that hopefully is a sign that all of the work being done is started to really see the fruits of the labor with cases really dropping. In addition to that, some of the wastewater testing we got. Wastewater testing, sometimes it makes sense and it flows, sometimes it doesn't. What we got this week kind of made sense, showing really in each one of our wastewater systems across the county, we saw lower levels than we had last week. So hopefully, again, another promising sign. Asymptomatic testing at the On Center, 7 days a week, covid19.ongov.net. Again, that's a rapid test. We don't, if you're sick with symptoms, we don't like you using this test. We'd rather have you get a PCR test at an Essential Health over the weekend or at the F-Shed. But again, for asymptomatic individuals, this is a good way to get tested to make sure that you're not carrying COVID in your activities. Asymptomatic community sites. Today, we're at Onondaga Town Hall. Friday, tomorrow, we are at the Lafayette Town Center. Monday, we will be at East Syracuse Village Hall. Tuesday, we will be at Shove Park in Syracuse Northeast Community Center. And Wednesday next week, we'll be at the Fayetteville Village Hall and the Town of Clay Senior Center. And then next Thursday, we'll be back at Onondaga Town Hall. And next Friday, back at the Lafayette Community Center. So, again, we're going out in the community, east, west, north, and south in our center city to try to give opportunities for folks to get screened even if you don't have symptoms. By identifying the virus and quickly isolating it, that's how we'll get this thing knocked down even further. And that's when we can really talk about moving forward and getting our lives back as we're vaccinating. Let's talk about the vaccine a little bit. And again, I want to thank the members of the media. Really, without you and your reporting, I don't know how we would communicate what we're communicating and how important this is. And I want to go through everything very deliberately because even though we're communicating as well as we can in a situation like this where the emotions are so high, there's always a lot of room for improvement. So a vaccine week is a Wednesday to Wednesday. And why is that? It's because we receive our allotments on Tuesday, and we were receiving 3,600 doses a week. This week we received 900, a huge cut. The region is still vaccinating new members of the community every day, but there's not the availability of new appointments because at the fairgrounds, which is receiving the majority of the doses, they booked out their appointments months in advance. Kinney Drugs and the other drug stores who are specifically giving the doses to seniors, same thing. They booked out the doses at least weeks in advance. We are only going on almost a day-by-day scenario because we don't know what supply will be there, and we're not going to cancel appointments. So if you think about the pressure when the only new appointments are what we're giving out, and essentially we have 1 day's supply, not even 1 day's supply. We're done in minutes up there today. It's really hours of supply. The amount of pressure on all systems is quite high. So on Tuesday we were all here together. We said we'll put up a link Wednesday afternoon. Wednesday afternoon we put up the link. We gave a reminder on social media. We didn't message just on social media. The day before, you all covered it very well, that on Wednesday there will be a link in the afternoon for people to go on. And within minutes, we had tens of thousands of people all on the application. So when that happens, unfortunately, it may look like you're going through the process and you can get a slot, and then you go through, and at the end, the slot's gone. So the best way to think about it, I don't have specific numbers, but right now, my estimate would be there's probably 80,000 people left in Onondaga County that are eligible for a vaccine, and they were all competing for 900 slots yesterday. That's just the reality. So this is frustrating for me. It's frustrating for everybody, but we've built up a network. When the vaccine supply increases, there will be more opportunities to get it, and we'll continue to get it out to people very quickly. So that's kind of what happens. We recognize, let me go through a couple other things on this. The 65 and above, there's designated slots at the pharmacies. Okay, we know that. We also know there's no new appointments. So that doesn't help the anxiety for all of our seniors. We know that local governments, we've been trying to micro-target our public employees our teachers, our firefighters, our police officers, our 911, our corrections officers, and we're targeting them. But also the state site was supposed to kind of be more of a senior-driven site, but many of the same public employees that we targeted went and got appointments there. So we know that right now communication with our seniors is really important. So we're going to figure out better ways specifically for seniors where we're tracking people's information moving forward. I don't have the plan today, but we will have one. We recognize that the information is not getting to all of our seniors, and we need to make sure that that happens, and we'll figure out a way. So again, I want to just thank the media, because I don't know what we quite frankly would do without you helping us get the information out right now. But we're looking at all sorts of tools and recognizing that many seniors aren't on social media. Many seniors don't get the digital media the way that a lot of folks do, and these are eligible folks, and they're our most vulnerable folks. So we're going to work on better ways to communicate, but even the communication doesn't change the fact that yesterday we had 900 slots, maybe 990, and we had 80,000 people trying to get it, and we know we had tens of thousands of people at the same time trying to get it. So the odds of somebody getting it yesterday was not good. When the supply increases, it's going to get better, and we're not going to leave anybody behind, and we're doing everything we can to crush this virus by identifying it and isolating it quickly right now in the community, and we're going in the right direction. So I just wanted to go through that, because I know as much as we talk about it and it's repetitive, there are many people who are hearing these messages for the first time. In addition, 211's been a tool. Again, 211's not going to schedule out weeks in advance. We give them slots every day just for our seniors. And when we have limited slots and limited vaccine, it doesn't meet the demand. And it won't. It won't meet the demand for a while, but we'll get through this. Second dose. So we have some second dose is starting next week. People get an email today. I think next Tuesday might be the first day, right, for second doses. Remember our first few days when we did our first doses, 100 or so, 200 or so, 400 or so, 500 or so. So that's kind of what the second doses will look like next week. But you'll get an email. Look for an email from COVID vaccinations if you're waiting on your second dose. And if you do not provide an email, we do have your phone number. You will get a phone call. If you get a phone call from Onondaga County, please return it. And so that's important. And again, the other piece of this is if you got Moderna on your first dose, you need to get Moderna on your second dose. At our pod, there's only been one day where we were doing doses of Pfizer, and that was that yesterday? Tuesday. Yeah, that was yesterday. So that may change moving forward. We may have more Pfizer, and at some point Johnson & Johnson or AstraZeneca. But for the most part, our supply has been Moderna. And just please be cautious of, unfortunately, I've heard about incidents of people in the community trying to take advantage, saying that you can give your information and you can get a COVID vaccine. Nobody has the vaccine. Right now, until you hear different from myself or a state representative, there's no more new appointments for this week in Onondaga County. The appointments are taken. Anybody telling you that they can get you a vaccine and asking for your personal information, it's a scam. And it's really sad and pathetic for those individuals that are doing this. We just got to hang in there. We got to be patient, myself included. We get pretty jazzed up trying to be ready for this moment to do it and do it quickly. We were doing that for 2 weeks. We're sidelined to a degree. And so if you're a former athlete and you're having a good game and your coach puts you on the bench for a little bit, it's not a good feeling. You want to catch that momentum, and we'll get it back, and we'll get everybody their shot. A reminder, um, if you're positive and you get a text message from 833-634-1564, that's us. We're asking for you to participate in the investigations. Fill out a form for us that will expedite the case investigations with our health department. We then turn that over to contact tracing, and they do their jobs. The faster we accomplish that, the more effective we are at getting this virus knocked back down. So saying that, happy to take questions.
President Biden just released on live television his coronavirus response plans along with a document. The document lists the word local or locality 200 times. I'm wondering how you're feeling about, not so generically how you're feeling about the Biden administration, but how you think your life will change responding to this with what we're hearing today out of the White House.
Yeah, I think, well, my hope is that there's a federal package for financial package to recognize the losses that we've had and help us moving forward when we get through all of this. The hardships that a community like ours will face are very tough to monetize now because we rely so much on tourism. So the opportunity costs of that, we don't know what those are. The second piece related to fighting the pandemic, the traditional method to fight the pandemic with vaccinations is you let the counties do it until they can't, right? That hasn't really happened here. It's been like a blend. I think when you pump more vaccine into the states, one option you have, which we've spoke to the Trump administration about too, is you can utilize the county health departments. I'm a federal representative from New York State on NACO, the National Associations for Counties, from the County Executives Association, and we've told NACO, and NACO's saying the same thing to the President Biden's administration now, is we have the infrastructure. Could we vaccinate 460,000 people overnight? No. And 2 shots? No. It will still take time, but potentially looking at various distribution ways, using the states and maybe sending it direct to counties too. That's something that we could do. But again, we're working pretty fluidly with the state of New York as well on this. Any new vaccine to the state, and if it will flow more here as well. I think that's the big thing is it's been well reported that the previous administration could have purchased more Pfizer, and they didn't. I don't know why they didn't. Maybe there was a good reason why. They haven't communicated why they didn't. But it would be nice this week having 10,000 doses like we asked for, not 900. So that's what we're looking for. There's no a top-down approach to public health is not going to work as well because the people who do public health are at the local level. And so hopefully it looks like the incoming administration recognizes that, and hopefully they'll be a great partner.
On vaccine equity in Onondaga County, when you report new cases and people who have passed away in our community, you're able to give us the demographics. Is Onondaga County able to start kind of quantifying who actually is getting vaccinated, the demographics they represent, to kind of get a better picture of where the outreach needs to happen? I've talked to other county health leaders throughout central New York about this same issue, them wanting to have more of that data at their disposal.
Yeah, it's important. And so right now, I think, Mary, it would be good if we had another couple weeks of good vaccination supply before we really start analyzing that and making decisions, because the free flow of your infrastructure hasn't been utilized, and part of the data is skewed, right? So part of the data that's important right now is the 65 and above for that point. Do we see demographic issues? Are certain minority communities not participating? Are certain zip codes not participating, right? A lot of the vaccine has gone to healthcare workers or to classifications based off of employment, where you can't control that type of data and that effectiveness. The governor's done a very nice job putting out what the healthcare workers are doing. We have a pretty good idea on education because we're talking to them and working with them. The education workforce is participating at a high rate right now. Law enforcement, not as high a rate right now. But what I think we were really interested in, and I think right now, if we looked at the data right now, it's probably too early to change your strategy because we haven't even been able to do more than 5,000 or 6,000 in our pod where we can do 18,000 in a week. So what I would like to see is that we get the supply up, we really start humming, and then after doing that, and after you have 40,000 seniors, 50,000 seniors, 65 and above through, you can really figure out geographically and based off of racial background where are we missing, where are we dropping the ball, and then we go micro-target. We have the ability to go and have mobile units into communities. And I think at some point in the near future, the state has talked a lot about this. I'm sure that will be part of the strategy moving forward. But we very much want to see the data because we very much agree with your point.
And you said law enforcement, is that participation is down? Is that just simply because of eligibility with the different phases, or is that because
they're eligible? So what we do is we do our best, and again, we try to survey the different populations and again, the governor's asked local governments to really try to micro-target in on these populations, and we know we know from education how many have got the first shot, how many got the second, not many second yet because they just became eligible, right? And then how many have appointments, and this is via a survey, right? So not everybody participates in a survey. And then how many aren't going to get it, right? So when you look at just the data that we've collected, I think education's over 80% they're intentionally trying to get the vaccine. That's where you need to be. The data with law enforcement, the responses weren't as great. And I know that the mayor's tracking his team. We have the sheriff tracking his team. But it just isn't as great right now. So that doesn't mean that it won't get better. And as people see more and more people get vaccinated every day and there's not bad outcomes, people get more comfortable as well.
Are you expecting 900 doses again next week?
At minimum. One of the things we asked for, the state talked about reallocating some of the long-term care doses that the pharmacies had that don't look like they're going to be used right now. They're looking to get their hands on those. We've asked for some of that. So next week's not going to be a great week. Could we get more than 900? I'm hopeful. But I think once you see that supply to the state get back to 300,000, 350, or 400, then we'll start to see more flow. And then there's no excuses not to give us more. There's just no excuses. We're the fastest, period.
In that 900, does that include the second doses or no?
No. So with every first dose we get, and those are 900 first doses, there is a second dose saved with every first dose. So again, if you're getting your first dose, you don't need to be worried about, am I going to get a second dose? Of course you are. At the national level, if the scientists and the doctors say, hey, we're going to change the way we do this, that will be big news, and everybody will understand that the program's changing. But right now, if you get a first, you're going to get a second. Your second with Pfizer is 3 weeks, and your second with Moderna is 4 weeks.
So if you get some reallocated doses, you might be vaccinating on other days than next Thursday. Is it worth people checking back?
Yeah, we'll communicate that with you guys and everybody else. Again, we're looking at different things to do with seniors so that we can address some of their anxiety. But if we get 900 doses, we'll be giving first shots 1 day a week. Next week we'll be giving second shots all week. But if we get reallocated doses or we get more, we'll do more than one clinic for new. So it's just a moving target, and I understand people are frustrated with not having certainty. Nobody more than me. I answered about 120 emails today on this very topic. So we just got to grind this out just like we have been. This has been a long process.
I'm not a doctor, you're not a doctor, but I'm wondering if you had a conversation with your health commissioner based on anecdotal evidence. It seems that nursing home case numbers are getting to a safer area.
Yeah.
Can we attribute that to the mass vaccination of residents in those places?
I think so, and I think many of the nursing homes have had the second shots. Your assisted livings have had the first, and I think that's when we look at this was running rampant through the buildings, and now the numbers each day are better. Sometimes the cases that are from those buildings are the employees, and we know the employees in nursing home and long-term congregate care facilities have not participated in the vaccine at the rates other healthcare professionals have. And that's going to be a challenge. We're going to need to do education with those groups to try to get participation higher moving forward. But I do think we are seeing signs that the vaccine is helping quite a bit with new cases. I mean, we were looking at 20% of our cases were from these facilities, and now anywhere between 1% and 5% a day, and again, about half of that are residents, maybe even less than that are residents. So positive signs.
Has Dr. Gupta weighed in with a medical observation on your non-medical observation?
I think she agrees with Dr. McMahon's analysis, but we'll have to get her on the record for that.
Are there any new cases that you're aware of residents in those, in let's say nursing homes specifically, since we know those are more percentage vaccinated?
So remember the timing on this. Once you get your first shot, you're still at risk. It really takes 14 days for some immunity. Let's see, looks like three residents yesterday positive, and we don't have 100% participation, right? Higher participation, but not 100. So there's still risk there.
How would you characterize the participation rate among the employees at nursing homes?
I think it was around 50, Tim. I think it's there.
So about half?
Yeah, we still got a lot of work to do there. And again, I think that's kind of why these adult long-term care, congregate care doses, there's a lot of them left because I think everybody thought 70, 75, and then later in the process you can get to people after a real good education outreach. And right now it just doesn't look like there's capacity there because just folks aren't taking advantage of it right now. So getting those back into the regions to get them into seniors, good plan. Hopefully they can execute on it.
You said we're making some progress when it comes to new cases reported every day and hospitalizations being down at least today.
Yeah.
Talking about yellow, orange zones, whatever zone, what metrics do we have to meet to start talking about getting out of those zones with our hospitalizations and those things?
So if you looked at hospitalizations, we'd already be out of them. And because of where we are now, hospitalizations became a metric once a microcluster to a positivity rate just wasn't the right regulatory framework anymore. And everything's got to be in perspective, right? So when you're used to 1% and you go to 4%, you think things are falling apart. But if 4% is the best in the country and maybe even the world, things aren't falling apart. You're doing better than everybody else under the circumstances that everybody's dealing with. So I think that's kind of what happened with the zones. The zones started right before the Halloween surge. The Halloween surge just threw everybody through the loop, right? So I think if you look at the regulatory, the regulations related to a yellow or an orange zone, they're specific to gatherings, and they were very harsh on restaurants, and that's been relaxed now. So now, because we're indoors and we know this virus does well indoors, the limited gathering number anyways is just smart. So whether it's a yellow or orange or you want to call it a winter zone, we really shouldn't be having gatherings over 50 anyways at this point, just because of the data tells us somebody likely has been exposed to the virus. So I think it's getting in the right direction. I think I've always felt if this time of year, if we can get this thing under 5 or keep it around 5, I think we're doing really well. And we should look at some practical things that maybe you can tweak. One of the things in the zones, if you're a family of 5 or 6 or 7 or 8, you can't sit at the same table. Like, you're already in your own pod, you live together. That's just not a practical regulation. So I think as we keep making progress, we can reevaluate these things and really push the state to move on some of these things.
Can you talk about Destiny USA? We know now that a big box store, Best Buy, is closing. What does that mean for the county? I mean, obviously, Destiny is a huge revenue generator, and it's taken a huge hit, as we know, as we've talked about through this pandemic.
Yeah, again, that's when you look at our region. We are what you call a leisure stay destination. People don't come here for a week to travel all over, but they come here for a long weekend. And Destiny is one of our tools in the toolbox, and certainly with they already were facing pressure with the way just retail commerce has changed. But in a pandemic, when you're not traveling, Canadian traffic is a huge piece of the business model. We haven't gotten that in a year, so they're hurting. And just like our hospitality industry, our hotels and our restaurants, and when that's a big piece of your economy, for us it is, you get hurt, and you got to find growth in other areas. So it's been a challenge, and again, that's something that I hope the new administration looks at for communities like ours and other communities across the country that rely heavily. Think about Nevada, the state of Nevada with their cities, how heavily they rely on tourism. These communities have been destroyed by this pandemic. So that should be part of the conversation. How do we not just make up for revenue so we can employ people and continue to fight this pandemic, but how do we get ourselves back on sturdy ground? We're going to need a little help.
Just going off that, the County Ways and Means Committee on Monday includes an increase in room occupancy tax.
Mm-hmm.
Hotels. Does that mean trouble in the budget?
No, that was passed. The state passed that at the end of the year. The county legislature passed that about a year ago. So the hotels and the Visit Syracuse and the arts and cultural organizations, to meet their challenges, advocated to raise the room occupancy tax. That is a tourism bed tax, so folks who live outside the community pay that. And so this has been about a year-long process. The idea was by raising that, we would make strategic investments in our entertainment infrastructure to help drive more economic activity. If that happens for this year, that might help us. If we actually can get some people staying at hotels, that might help us fund some of these same organizations that were cut in previous years. But this is not that's not a general fund expense. That funds this building's operation. Visit Syracuse. Think of every arts and cultural organization. They get funded out of that. Think of the Syracuse Nationals. Think of these types of events. That's what funds them. And again, that you can budget whatever you want for that, for room tax. If nobody's spending a night at a hotel and paying the room tax, that budget is zero. So that increase that you're referencing has been a process for over a year now, and now it's coming to fruition. It was finalized. The Senate and Assembly passed it. The governor signed it. Now the legislature has to enact it.
50% for nursing home staff. What are your general percentages for teachers and for police officers?
It's early. They haven't been eligible as long as those facilities. I think I saw something from and again, this is anecdotal, Andrew, because I don't know if everybody participated in the survey. We sent out a survey to all the districts and none of their employees. And I believe we had almost 4,000 people get their first shot, another 4,000 as far as teachers and educators, another 4,000 were scheduled. Then there was 1,900 who weren't interested, and then there was, I think, 3,000 or 4,000 that still wanted to get an appointment. So overall, to me, that tells me the demand's over 80%. And then those extra 20, I bet you after they see their colleagues are okay, then they probably get interested. The participation amongst some of the other 1B groups was not as great. So the data was, you know, how good it is, I don't know. The law enforcement participation wasn't as great. So it just doesn't look like we're getting as much participation.
What makes you say that, though? Can you give me a percentage on police? Or
I don't remember it. I knew you guys would be interested in the education, especially you. So I was pretty good on my data there. But I don't. If I'm only getting 200 people replying to the survey and there's 6,000 or 4,000, whatever the number is, it's just not good information. I know that the mayor's tracking SPD, the sheriff's tracking his team, and I know that we need to do better.
That's K-12 education? Or does it include-
Pre-K-12.
Brian, the last couple of weekends, the state allowed almost 7,000 people to go to the Bills games. Are we at a point here, public health-wise, where you want to do that with either the Crunch or Syracuse University?
I think for Syracuse University would be the right point to go first. And I think the university is putting forward a plan, asking the state. We've had conversations. I've had conversations. They have. I think they're putting forward a plan with a date. And I haven't read through it. But in the summer, we were talking about students. Why students? Because we test them and we can quarantine them. I believe this would be students as well. So and it would be modeled very much after what Buffalo did. And so I know. So I think with where the data is, essentially 5 to 5.5, and where things are trending, I think now is a time, if you're testing these students, and the Syracuse University has built their own testing capacity, their own lab, the ability to do their own rapid testing, then we know they're not negative. Doing it in a controlled pilot, why not? We did it in Buffalo. It worked out well. It was a big success for the state and their partners. Let's do it here.
that would be just students?
My understanding is that we want to crawl before we walk and run. So the students are part of the testing protocol anyways, and they know that they can take students and keep them in dorm rooms hours in advance and whatnot. So I think that's a model. I haven't seen the full plan, but I'm supportive of trying to get some students in some of these basketball games in short order. I think the data merits it.
They're trying to get it, from your understanding, I know you don't know the exact date, but before the end of basketball season.
Yeah, I think, again, assuming under the assumptions that we stay kind of where we are. I think when you asked me this question before, or somebody did, I think we were at 8 or 9%, and I said, no, we're not ready for it. Now we're at, 5.2. I think it's a good conversation. That 5.2 is lower than where Erie County was for the Bills games. And Bills Mafia, I don't know if you saw some of those YouTube videos, very impressive celebrations. But I think if we can do it there, I think the governor and the state of the state talked about ways to open things up using testing. This is a good opportunity here for us in Central New York. The women's team is off to a great start. The men's team is a very talented team. These students have not had that college experience of being in that brand new building. Let's give them that experience.
Are there any efforts going on right now between Onondaga County and the city of Syracuse as we try and just gauge the economic impact and what we're going to have to come back from to recover from this, to consolidate services to help with that money saving?
Yeah, one of the things we looked at and we had in the budget that we, from an efficiency standpoint, and it would save us money, was consolidating information and technology. I put that in my budget. The mayor was supportive of that. the county legislature and the common council did not want to support it. So that's something that the mayor and I both support and are willing to get going. The county legislature was considering it. The common council all wrote letters saying they didn't support it. I don't know why. Very IT's IT. But that's something that we think we can do more together. And I think down the road we continue to take a look at things. There's certain things that the city does that the county doesn't do, and that we're never going to probably do. We don't have a fire department. We have an elected sheriff. They have an appointed police chief. And so there's just different things that are in the same realm, but it's just to say go consolidate police or fire. Sometimes it doesn't make sense. But the things that we're in the same business and we do, those are where the opportunities are for us to do more together. And sometimes it's better to have it under one roof and not two.
Can you be more specific when you say IT, and if there's a ballpark of how much money that would save?
Yeah, the big thing with information and technology is right now in today's world, cybersecurity infrastructure and cybersecurity threats are a daily routine, and consistently paying to deal with that and to keep talent, to have two governments competing for talent and then two governments paying to help do that is just redundant. So a lot of these costs are costs we'll see in our budgets moving forward that we could avoid. But we had, I think the city was going to save $1 million or so because we were going to put the cost on the city-county abstract, and we had a decrease in the abstract, so it wouldn't have cost the taxpayers in the city any new money. So the city budget would have saved $1 million or so. Interestingly enough, it looks like they're getting cut $1 million from the state, so that deal right there could potentially make up that gap. And then your costs moving forward, and for us, it's that cybersecurity, that infrastructure buildup, and we just had early retirement incentives that we had to give out because of the fiscal situation. And for us to bring on some of that talent to help us as well was a real upside. So it was one of the things out of the budget I was very disappointed about that didn't make it through. But there's still an opportunity to get something done.
There are some people, like Chicago Mayor Lori Lightfoot, who say shutting restaurants forced people inside homes for gatherings where things weren't regulated, and that's the reason for the current surge. Do you buy that?
Yeah, I don't know if there's enough scientific data there, but I've been kind of hinting towards that for a while. I think you're going to have a surge anyways because you had gatherings no matter what. But usually some of this gets spread out a little bit more if they're in multiple venues. The restaurants, and which transition to bars at night, many of them, were being regulated. We could regulate them to make sure that people were at a table, they were distanced, they were sitting. You didn't have 100 people congregating around a bar. There was mask wearing. We can't do that in homes, and we never will be able to. So certainly, to the mayor's point, that could have led to numbers. I don't think we will know that answer for a while. I think there will be studies done on that very question, but it's a rational point.
Do you think the phases were broadened too quickly? Are there examples of a very young, healthy police officer, or even a very young 65-year-old who maybe got a vaccine right away when they could, yet there's 90-year-olds who are struggling to get one still?
I think it would have been good to get a big dent into the 75 and above. And we weren't. I don't think we were able to do that really. So each week we have at least 10,000 new members of our community that are getting vaccinated. The healthcare workers absolutely agree with. And then I think your next was education, law enforcement, 75. I think really focusing more on the 75 and above before anything else got opened up would have been better. And so, because what happened, the supply didn't change, right? The supply was the same And then all of a sudden, all these new categories qualified, and they were competing with your 75-year-olds for appointment registrations. To your point, Andrew, we've had, in Onondaga County, we've had 4 people under 40 years of age pass. 4 under 40. We had 569 members of our community die. So 4 is less than 1% of the 569. So there's no question from the data where this virus really attacks. It doesn't mean somebody under 40 can't die or get very, very sick. And that doesn't mean you don't want all your frontline people getting the vaccine as quickly as you can. But this is our tool. This is a race. This is how we really hit back. So we'll be able to, I think everybody acknowledges what has happened. The CDC said open up. The state's position is the CDC told them to open up to the categories. They thought they were going to send more vaccine. Well, they sent less vaccine. So this is kind of where we are now. And then what happens? What happens is we're opening up 900 new appointments in the community for a week, and you have 80,000 people trying to get them. And then you got a lot of really upset people every time we go through this process. So we're at the bottom of that hill. We know it rolls downhill. We're at the bottom of it. So then my office is dealing with calls and emails all day. And that's why we just need to keep communicating and communicating.
Ryan, I know you're working on a new structure for how people are going to sign up for vaccines, and it sounds like maybe you're trying to get away from the 45-minute free-for-all online, but is there anywhere, I'm sure everyone in this room has been contacted many times by people who are interested in just getting on a list because they're not good at quickly getting to a link. Is there such a place yet, or?
Not yet. We're looking at it, Tim. How do you? So if you got 80,000 people, do you make an 80,000 person list? I don't know, right? Like we haven't been here before. I'm more concerned with our seniors that are not as tech savvy. It's clear to us in the communications we have where the issue is. We can communicate to school buildings to get out to their staff, and we can communicate to law enforcement. We can communicate to 911 and everybody else who's eligible. It's the tens of thousands of seniors that is harder to communicate to. So that's where we're trying to find a solution for some sort of pre-registration, knowing that it's going to be a long process no matter what. It's tough. We're all ears if people got good ideas. If they can solve this problem for us, I'll put you on the payroll.
And just a detail, does the county allow people from outside who live outside the county to get vaccinated?
You're going to have a little bit of overlap there, and not outside Central New York region, but you do have our people going to Cayuga County and going to Madison County and other counties, and you do have people who teach our children who live in another county. So if you're from Oneida County and you teach over at Ed Smith, it's important that you get vaccinated because you are interacting with my residents every day, and they're interacting with you. So there is a small percentage. We track it. It's under 5% at our pod. At the state pods, anybody from anywhere can go in New York State. So I'm not sure what their demographics look like, but the supermajority will be from Onondaga County. But we're not, if you are from Long Island, you're not going to get a vaccine here. If you're from out of state, you're not going to get a vaccine here. Because you got to get your second vaccine here too. So that's just, what it is. And we know there's people in our county traveling to these state sites right now as well.
We're a day into the new Biden administration. Have you personally, just from your position that you're at in our community, have you felt a tonal difference in what this country is hearing about fighting this virus and just kind of just an overall tone shift at all about the national strategy trickling down to the local strategy?
Yeah, I think so. I think what's important, the communication's been better, and so that's different, right? The data sharing is what we really would love to see. The 1 million doses in 100 days and 100 million doses, that's the pace we're on right now. So quite frankly, I think we got to do better than that. Right now as a country, we're almost at 1 million a day. That's an easy goal. Let's set the bar a little bit higher. And I think what they're doing with the Defense Production Act is smart. And that hopefully will get the supply going more. And I think some of these drug companies have more supply. We need to leverage as a country, our ability to get more of it. So, but the communication is much better in 24 hours. We'll see if it lasts. I'm an optimist, and when you're an executive, your job is to govern and manage, and it's not really your job to throw bombs. That's what the legislators like to do. We'll continue to manage and govern and work with all of our partners to get all 460 to 467,000 people vaccinated if they want one.
You have some legislature in you all the time, just so you know. No, real quick on that. Is the communication been direct to you from a level at the White House to a level in Onondaga County, or are you talking general community press briefing?
Yeah. So we have spoken to, I referenced before I was on a call with other leaders, and we spoke with the Biden administration a week ago. And so we don't expect to hear from the President of the United States team every week. What's important is that they're talking to NACO, the National Association of Counties, and then that information is flowing through us, and they're looking at feedback. And not every state's created equal related to their distribution or community related to their distribution. We don't need more distribution. We need more vaccine. And so other parts of the country might need more distribution, so I think that communication's important, and it's happening. And I'm sure the governor's communication is probably on a daily basis, would be my assumption.
Ryan, you mentioned scammers now are targeting people. What specifically are you hearing? Are there telephone calls?
Yeah, I think, and I heard people, even on our last briefing on Facebook, people were asking questions, and then people reached out to them, suggesting they had the vaccine if they shared information. So really disgusting stuff. So again, there's no vaccine in Onondaga County right now. There's no new appointments until you hear either from the state of New York or me. Anybody saying they have an appointment for a vaccine for you is lying. So I think just people should know that. Like anything, there's a real cesspool of individuals out there that try to take advantage of people and take advantage of seniors. And our seniors right now are desperate to get this vaccine. So
has that been mostly on Facebook messaging then?
Yeah, that's my understanding. Other questions? Okay, folks. Well, thank you for being here, and we will see everybody on Monday.